Focus on Aging Adults is sponsored in part by AARP.
Pennsylvania has one of the largest aging populations in the country. Our aging adults are vibrant, active contributors to our society. PCN, in partnership with AARP, present Focus on Aging Adults.
Welcome to Focus on Aging Adults. I'm Larry Casper. This program is brought to you in partnership between PCN and the AARP of Pennsylvania. Today we're talking about Governor Shapiro's new state budget proposal and how it could affect seniors. Our guests are the State Secretary of Aging, Jason Kavulich, and the State Director of AARP Pennsylvania, Bill Johnston-Walsh. Welcome to our program.
Thank you.
Thank you.
Bill, we're going to start with you. Before we dig into the new state budget proposal, just how big is Pennsylvania's senior population at this point?
It is very big. Basically, we have about 3.4 million older Pennsylvanians in the Commonwealth. We're the fifth largest in the country with that number. And really a number that I always talk about, and I know the Secretary always talks about, is right now 1 in 4 individuals are over the age of 60. In 2030, so I have to say, that's in 5 years.
That's only 5 years. That's almost around the corner.
That'll be 1 in 3 will be over the age of 60. So that means in 2030, we will have more individuals over the age of 60 than we do under the age of 20 in the Commonwealth. So we have to make sure that we are prepared to be able to support that growing population, whether it be in their community, whether it be through a state budget, local, whether it be through our Aging Our Way PA. We need to be able to be there to be able to make sure that they age in place in their homes and communities that they want to, that they're healthy, and that they can function on their own as they grow older.
And briefly, let's talk about the factors that are growing our senior population. Secretary.
Well, we are the fastest growing population in Pennsylvania. I think that's something, too, that the governor and the administration has highlighted from the very first day. So there's been investments since the very first year in older adult services and systems that support older adults and make sure that older adults can live and remain in the communities and in the environment that they choose. So it's been a priority from the administration. And this demographic is when you think about who the area agencies on aging, who the Department of Aging serves, we serve people from 62 end of life, and that is a big gap. So there are very, very different populations we're serving, but the need is still tremendous. And we continue to, advocate for the resources necessary to make sure people can live how they choose.
Well, let's explore the factors that are growing our senior population. And people are living longer, aren't they?
Right. Individuals are living longer. People are making better life choices, so their life continues. Healthcare is improving. And again, all of those factors have contributed to people being with us for a much longer time.
And I think the other piece of that too is that financially, when you retire, Pennsylvania is a good place to be able to do that. There's no tax on your Social Security, state tax on your Social Security here. So we do have, what we see is that we have a lot of those snowbirds. They go down south, Florida and the Carolinas and Georgia, but as they age down there and they're not as active, they come back, and they're coming back because it's what they know, it's where they grew up, and also their families are back here. And their families are going to be the ones going to be taking care of them or helping to help them in the community. So yes, they're living longer, they're healthier, but they move away, but they always come back. Pennsylvania is a great place to live.
And the cost of living. The cost of living in many of our communities is lower for them. So you see, especially in like a community that I'm from in the Northeast, we do have people from New York and New Jersey living in our community because it's more affordable for them to retire and move back into Pennsylvania.
Now we're about to explore the details of the governor's new budget proposal. And before we do that, let's talk about area agencies on aging. That's got to be an important component here. And I want our viewers to thoroughly understand what that network of offices is.
Well, we have 52 area agencies on aging in the Commonwealth, representing all 67 counties. The area agencies on aging really are our front door to aging services everywhere. So whatever your need over the age of 60 or a grandparent raising a grandchild 55 and older, come to an area agency on aging. You will get direction, you will get help, you will get support. We do everything from transportation in those offices to to meal delivery services, area agencies on aging help with personal care, adult day services, senior centers, you name it, their hand is in it. Whether it be a housing concern, whether it be help getting your farmer's market voucher, whether it be help doing your property tax and rent rebate, an area agency on aging is there to serve you. And they do some incredibly important work in protective services. With this increase in need in protective services in that space, unfortunately, we have seen financial exploitation grow to be our #1 reported of need in the state, outpacing self-neglect, which has traditionally been the highest report of need that we receive. So this need
just not seeing the doctor and knowing how to take care of yourself.
Or choosing differently how to live your remaining years of your life. You know, everyone still has self-wills, has the right to choose how they want to age. But these individuals who have been exploited, these individuals who not just by family members but by outside sources have had their resources taken from them, exploited from them, it is a huge challenge in Pennsylvania. Billions of dollars are lost every year. We know this is a growing concern. All of this work happens in the Area Agency on Aging. All of this happens in communities all across PA, and it happens with our partners. We can't do the work alone. But we do need to stand up that system. We do need to invest. That's why the governor has asked for $20 million to support area agencies on aging, to make an investment in stabilizing them, to make an investment in growing their services so that we can meet the demands of the fastest growing population in Pennsylvania.
Now, is that the total funding, or does that represent an increase, the $20 million?
The $20 million represents an increase to our Penn Care. Our Penn Care line item is the lifeblood of what an area agency on aging does. It's their most flexible funding line item that allows them to serve their community in the unique way that their community needs to be served.
And I just want to take a step back for a second. I think, you know, a lot of people in the Commonwealth don't know what an area agency is. They are on the front line, as Secretary Kavulich said, but I think the Secretary and this administration have done a better job of letting people know that the area agency is there and why they're there and how they can help and what programs that they have. I think what happens is, you know, someone takes a fall in their home, they go into a hospital, the next thing they know is like, okay, what do we do? Do we want to go back to our home? Can we go back to our home? Do we have to go into a facility? That's where one piece of the puzzle of what the AAAs do. They can do assessments. They can come out. They can say, you know what, you can come back into your home, but you have to modify it a little bit. Those are the simple things. People are in stress when this happens.
When there's an emergency at hand, that changes everyone's judgment.
Everything. And the AAAs are there on the front line being able to help individuals. And I think, like I said, not many people know that until they come into this crisis. And I think this administration with the Secretary have been getting the word out there to say, hey, the area agents are here and this is what they do. And you can rely on them to make sure that they're going to help you and help your family while they're in the community.
Now let's do a quick review on the area agencies on aging funding. In other words, let's look back a year. Now my understanding is that the funding for these agencies was flat last year. Is that right?
That is correct.
Mr. Secretary? And what were the consequences of not having a raise last year?
Well, we're coming off of two things. One, the area agencies on aging were flat funded. And two, the AARP dollars that we had from the pandemic.
Did you say AARP?
Yes.
Tell me about that.
Those are the federal dollars that were allocated specifically to the Department of Aging to really help with the COVID crisis and the pandemic, to prop up services for older adults, to make sure that they had the services that they needed, because we knew the pandemic hit older adults harder than other segments of the population. So while there was, the state and other state entities received funding in this manner, the Department of Aging had specific dollars carved out for them. That represented a significant amount of resources in the hands of our area agencies on aging. And when that funding expired, we saw the area agencies on aging reset to pre-COVID funding, and those dollars were flat funded last year. And the impact on that is we've seen senior centers have to close. We've seen reduction in meal programs. We've seen reduction in other senior programs. We've seen a reduction in other aging services because we're just trying to keep as many people served as possible, but those resources are not going as far.
And I think the other thing to keep in mind too is that Secretary Kavulich and his team at the Department of Aging, this because of the funding from the federal funding going away and being flat funded, there would have been a lot worse. There would have been more closings. There would have been more people on waiting lists. But they were able to move some dollars around to be able to help the AAAs on the front line so that they're able to keep these programs going. But that's not going to be able to happen again. They moved a lot of their dollars around and tried to support it as much as possible. But they're going to need these dollars. If you talk to the AAAs, they're going to need a lot more than the 20 million that is out there, but I think this is a great a beginning point to make sure that they're able to continue to keep their doors open so senior centers don't close, so Meals on Wheels can get out there, so people can come and be able to get the services that they need at the local level.
If the governor's budget proposal goes through, and of course I want to emphasize it is merely a proposal at this point, just what kind of tangible benefits will people who could benefit from these services notice?
Well, first of all, you'll see a reduction in waiting lists. Second of all, you'll see a stabilization of things like senior centers and other aging programs.
Oh, talk about a minute just about the waiting list, how long they are typically, what kind of services they're expecting.
So, you can be on a waiting list for a number of services, or you can be on a waiting list for all services, depending on your service area. So, you might need meals and in-home assistance, and the Area Agency on Aging has only the funding to do meals. So you're waiting for in-home assistance. You're on a wait list for those. Or you can be at an Area Agency on Aging that's struggling even further, and you're waiting for, meals, in-home services, and maybe adult day services. Okay, so there are a variety of scenarios because it is such a person-centered system. So we can't say everyone's waiting for meals. You can't say everyone's waiting for in-home services or everyone's waiting for an adult day. It's a person-centered system, but the bottom line is if the resources aren't there, the care plans can't go into place.
And there are 52 area agencies, as we said earlier. So there may be a longer waiting list in some of the AAAs than others. As the secretary just said, it could be because there's more people waiting for meals, in Montgomery County, but in Allegheny County, it could be home services that they're waiting for, type deal, home health services. So again, it doesn't, you can't give just one big look because each county, each AAA, each of all 52 are moving their dollars around in different ways, again, to make up the shortfall.
Has there been any specific AAAs? I'm going to adopt that, Bill. And we're not talking about the Auto Club. We're talking about the Area Agencies on Aging.
Correct.
And there are 52 of them. Has anyone ever gone under the chopping block and just been threatened and it was just on the edge? How close have some of those offices come to closing?
I don't. They haven't come close to closing. But they have had to make really hard decisions that impact communities in sometimes pretty negative ways. Yep. So you see, a whole region lose several senior centers. And by the Older Americans Act, we're only required to have one senior center per AAA. But in all of our 52 service areas, there's multiple because, as you can see, we have AAAs that serve more than one county. So you have Union Snyder County, you have Bradford, Sullivan, Susquehanna, and Tioga County. They're parts of a joinder. So it's really hard to decide what one county would the senior center be in. So we have resources. We have, we started the year off with 485 senior centers. The numbers dipping down below 450 now. So we are seeing this significant change, but it impacts communities tremendously, especially our rural communities, and many of our rural communities. These are the lifelines. This is where people go, not just for socialization, but for connectivity to services and to get answers to some of the really hard questions that they have. And they're really a vital part of life.
That's exactly right. And I just want to emphasize the rural piece of it. Yes, there are needs in suburban areas, and especially in urban areas of the state. But the rural areas, as the secretary just said, you had one in the northeastern tier of the Commonwealth. That's a lot of land. That's a lot of area for one Area Agency on Aging to be covering and making sure that they're hitting all the pockets and the needs of those individuals. And it's tough, whether you're talking about transportation, whether you're talking about meals, whether
there's a lot of real estate up there.
There's a lot of real estate, and that's just one example of the rest of the state as well.
Jason, would you explain to me the relationship between your department and the area agencies on aging? I know that there's some connection, there's some oversight, right?
Well, there's a lot of oversight. We are the state unit on aging. We are responsible for all Older Americans Act services. 19% of our dollars come from the federal government to administer Older Americans Act services. In Pennsylvania, we are blessed with a lottery system that gives us 81% of their dollars. That really helps us keep programming, really robust programming happening in Pennsylvania. We're blessed. We truly are fortunate that others had the foresight to create the lottery to benefit older Pennsylvanians. So we have oversight over our 52 area agencies on aging, and they have a contractual agreement with the department to provide services in their selected service areas. And so by that contract, we have oversight. We have oversight over protective services. We have oversight over the services they do under Older Americans Act. We have oversight of what they do on services that we have that are lottery funded. We monitor them routinely. We monitor them for the quality of their work and their responsibility to follow rules and regulation. And we monitor their fiscal activity as well.
And how frequently are you in touch with the 3As as far as oversight is concerned?
Daily. Is
that right?
Our department, we're not a big...
The Department of Aging is in touch with them every day.
In some way, shape, or form, yes, because we are a small department, but we cover a very big scope of work. So whether it be a protective services issue, a transportation challenge, a wait list issue, a financial issue with reporting and data, or an older adult that's unsatisfied with the service, there is some activity at all times in the Department of Aging happening with one of the area agencies on aging. Or we have a work group that's devoted to the improvement of our work meeting. Or we have a work group that discusses the difficulties it is to attract and hire new workers meeting. Or we have a work group like we do with AARP, looking at laws and legislation that are coming down that we're all advocating for that will make the lives of older adults better. And we're all working together to implement Aging Our Way PA, our 10-year multi-sector plan, to make the lives of older Pennsylvanians better, to do what they told us to do in our listening sessions, and to really lift up our system.
Let's talk about something else that's included in the governor's budget proposal, and that would be funding for direct care workers. Bill, get us started on that. Just what is a direct care worker?
The direct care worker is someone who helps either an elderly person or somebody with a disability. It could be either in their home or it could be in a facility, a nursing home, assisted living facility, something like that. And then these individuals take care of their daily needs. They help them from possibly either cooking for them or cleaning them, giving them their medicines. It's a whole host of things that they do. One of the issues that's been happening over the last couple of years, or maybe even the decade, is that it's hard work. Let's just put that right out there. And you're going in and you're taking care of someone on your shift, so you could be there for 8 hours or longer, and you're basically doing this for very little pay. You're doing this for not many benefits that go along with it. And I think you're also, if you can make more out of McDonald's than you can, serving fries and a burger, than doing this, there's more people going to be able to go to another industry. In
order to take care of your own family.
Take care of your own family, your own needs. So they're going to be able to do that. What we're saying at AARP is that we need to be able to raise those dollars. We need to get those, hourly wages up. We need to be able to train people better to get them into this system, so that they know what they do. Have some development needs for them. So if a direct care worker wants to become a nurse one day, what line of training do you need to be able to do that? And how can we be supportive, not just as AARP, but as a Commonwealth and as a country on that front? And I just think that in this budget, there are dollars that will be going towards that, being able to help that and get the.
Will it raise wages, for instance?
Yeah, and it keeps people in the need. We're seeing that, as I mentioned, the numbers. We're going to have 1 in 3 in just 5 years. Some of those individuals will need care in their home. They will need care in a facility, and if we don't have the dollars to go along with it, we will not be able to meet the needs of an older Pennsylvanian and their family.
And what about training for these people, Bill? You want to make sure whatever money is spent on them is accountable and wisely spent.
Sure. I mean, obviously, if someone's going to be coming in and taking care of one of your loved ones, whether, as I said, whether it's in a nursing home or in their own home, you want to make sure they're trained. You want to make sure that they know what the needs are of that individual. That, how do you lift them if they fall properly? How do you make sure that you're giving them the right food that for their dietary needs? Those are the kind of things that you're looking for in training an individual. I think it should be done. It's something that is definitely needed.
About how many Pennsylvania seniors need these services that you're talking about, Bill?
Jason, I don't know that answer.
It's a really hard number to predict because you're talking about two different systems: Department of Human Services, Department of Aging.
I see.
So nearly 1 million older adults benefit from the system that we have at the Department of Aging every year. So nearly 1 million of our nearly 3.4 million older adults benefit from our system. Many of those, in fact, when I was an area agency on aging director, my largest portion of my budget went to direct care work. So personal care, in-home services, that was the biggest portion of my budget. So that, using that as a cutaway of what happens in an area agency on aging, knowing that's how important this work is out there. It's the hours that keep people in their home. And it's our obligation not just to pay those and train those individuals well, but to make sure those individuals are safe. You think about this, you're an older adult, your children live out of state, and there's a person coming into your house to help give you a bath. They're going to see you at your most vulnerable moment, okay? And then, you want to know they're safe, you want to know they're reliable, you want to know they're trained.
Yep.
And you want to know that they're invested in care. And that's what this budget will do. Will help us restore that workforce.
Now, direct care workers need some time off too. Is there anything in the budget that would improve time off for them? Because they need a respite too.
I don't know if there's anything in the budget for that. I know there's $21 million specifically for this piece.
Yeah.
I know that one of the key issues is affordable health insurance, and I know that is also being played into this $21 million, and I think it's going to roughly help 8,500 direct care workers be able to afford their health care. So there's pieces like that. The time off, I'm not sure about that aspect of it.
Jason, review a point you made a while ago about the lottery being important to senior services here in Pennsylvania. And that makes me think of, I'm trying to make a transition into skill games. That's what legislators are talking about. That's the debate lately. Skill games resemble slot machines. You can find them in pizza joints, social clubs, convenience stores. And they tell me that there are about 70,000 out there. And I wonder, there are concerns that skill games may have an effect on lottery sales because some establishments will have your skill game and they'll sell you a lottery ticket too.
I
wonder if there's a competition there.
Well, I think with all forms of gambling, there is some form of competition, and I think this budget proposes a way to level that playing field, to make sure that the lottery stays competitive with other systems. I think that's what the intent is here, and fortunately, in regulating skilled games, there is a carve-out for the Department of Aging for all aging services, because a portion of that carve-out goes to support the lottery fund and help stabilize our lottery fund. So that's an very important component to regulating the skilled games. That regulation helps keep the lottery fund safe and continue to help us provide services for older Pennsylvanians while we're living through the time of the greatest expansion we'll ever see.
And as of right now, skill games are there. You just mentioned the 70,000 skill games. They're out there. They're not being regulated. They're not being taxed.
They're completely outside the law.
I don't know if they're completely outside the law.
Except the manufacturer. You got to make sure.
Yeah. So they are not on the same level playing field as other games of chance.
Slot machines, for instance, are taxed at roughly 52%, and the governor's proposing a similar rate for skill games.
Yes, he is.
Yeah, it is. The tax rate is about 52%. You are correct.
And who would take care of regulating these games?
I'm assuming it would be the lottery, but I don't know.
I think it's going to be the State Game Commission.
I thought it could be the Gaming Control Board.
Yes.
That's not the same as the...
I'm sorry, yes, the State Game
The Game Commission is for hunters, yeah.
Yes, you are correct.
Well, how about this, gentlemen? There's a concern out there, and some legislators are voicing this concern, that if the tax rate goes too high, it won't pay for an establishment to even offer a skill game. So you got to know how to hit the sweet spot here.
That we can go back and forth with that debate. But have we seen casinos suffer from this? So I mean, there are different arguments. There's different logic, but people like it. They're going to keep doing it. I visited an establishment this weekend, and people were using it, but right next to them was a lottery machine. So. We want to make sure that playing field's level. We want to make sure the lottery stays competitive. The lottery was established, for Pennsylvanians, to benefit older Pennsylvanians, to make sure that we have the resources to do the property tax and rent rebate program, to do important programs like PACE, our pharmaceutical assistance program, to support area agencies on aging. And in this time that we're seeing, the Older Americans Act potentially, suffer some setbacks and federal funding becoming, less into our system. We will need the lottery fund for older adults more now than ever.
And we've had casinos for quite a few years now operating in Pennsylvania, and the revenue has continued to go up across the board. There hasn't been any dips in that time. And there hasn't been any dips in New Jersey or Delaware or any other surrounding states that also have casinos when it comes to their lottery as well. So I don't think that's an issue. I think that's an argument that the other side is utilizing right now. I think the bottom line here is that the more money that is going to be coming in for the programs that are going to be impacting older Pennsylvanians and all Pennsylvanians, because this with the skill game, it's not going to just go towards older Pennsylvania, as the Secretary said. Just a specific amount is going to be going towards older Pennsylvanians. But again, more dollars coming in, especially from we don't know what's happening across the board, not just within the state, but also at the federal level.
Now, earlier in the program, we talked about the basic value of awareness of programs. People can't take advantage of a program when they don't know about it. And I thought of that just a minute ago, Jason, when you mentioned PACE, and that probably leads to a discussion of PACEnet as well. So briefly, just take that opportunity to tell our viewers who don't know about it yet, but they will want to know at some point, what PACE is about.
Well, that's our pharmaceutical assistance program, and it really helps those that fall between in the gap area to make sure that they have life-saving drugs, to make sure that we have a resource for them. So we can call the PACE hotline. Out of all the numbers that I have in front of me, the PACE hotline isn't one of them. You can call the PACE hotline. We can walk you through the process. We can get you signed up if you qualify. We can help get your medication right away. We work with pharmacies all over the state to make sure that we have what you need. We can get you connected to what you need. And in some of these rural communities, we see their local pharmacies closing. And PACE will help you get connected to that. PACE helps with a number of things, just like our senior nutrition boxes that come from the Department of Agriculture. You can call the PACE hotline. They will help get you signed up for that. So we have programs like PACE and other programs that really are robust.
Then there's PACEnet, and that's an expansion of PACE, maybe different eligibility.
Different eligibility, different criteria, but I said all it is one phone call to the PACE hotline. We'll walk you through and get you where you are qualified. And if we can't qualify you for a service, we'll help walk you to somewhere that can.
Yeah. And this is one of those services made possible by the PA Lottery?
Absolutely, yes.
Exactly. And it's interesting. AARP, we have 1.8 million members, and we do get a lot of calls in from our members. I can tell you that the PACE hotline and the PACE system is the most seamless one. I've never heard any complaints the whole time I've been, for almost 20 years now with AARP, and not one complaint has come in with that. So it's run smoothly, and the benefits, keep people in their homes. It's another piece of the puzzle, piece of the pie that keeps people in their homes as long as possible. Yep. And it's a very well-run program.
Let's talk about public transit or mass transit within the context of the governor's budget proposal. But first, let's consider this. Given the growing senior population, how has reliance on public transit changed in recent years?
Well, I think many older adults, it really depends on the service area you live in. I mean, how you utilize, how you access transportation. We have partners in southwestern PA that it's a real struggle because there's not good public transportation. Our rural AAAs, they struggle too. Shared ride, there's continued pressure on shared ride. That's those small buses that you see taking individuals to medical appointments, grocery stores, and other appointments that are necessary. Dialysis, to keep them safe, keep them in their homes. There's pressure on all of these systems. It's an urban and a rural problem equally. The resources needed are resources that we need in public transportation across the board. And for older adults who rely on services, especially shared ride, it's a critically important subject. When we did the outreach for Aging Our Way PA, we did all the stakeholder engagement. The third highest returned comment was on public transportation.
Mm-hmm. And if you remember, the governor proposed an increase for public transit just last year, and what became of that anyway? I'm not sure legislators followed through on that.
It's something that we're still, the legislators are still looking at. The governor still is, still a priority for the governor.
Yes.
And I think it's a priority for the House and Senate as well. It's just the funding aspect of it, I think, is the sticking point at this moment in time. So I think everyone across the board sees it as Secretary Kavulich just said, when we did Aging My Way PA and had all of these meetings across the Commonwealth, across Pennsylvania, the third largest was transportation, and the legislators know that. They know that there's a concern, especially the rural legislators. They know there's an issue and concern there. I think one of the things that came out of the multi-sector plan and the Aging Our Way PA is that there's other ways to look at this as well. People do need to get to different places. So you look at maybe Uber, or you look at some other things like volunteers, starting a volunteer corps of individuals helping people around, or working with religious organizations. There are definitely different ways of doing this. I think when it comes back to Pennsylvania and our government here, everyone sees it as an issue. It's basically, how are we going to fix it to make sure it's equitable across the Commonwealth, and then also how are we going to get the funds to make sure that it's going to be done in the right way. And I think everyone from our House and Senate, as well as the Governor Shapiro, think that it's an important issue.
And just to take a step back, when you talk about the Penn Care line item earlier on, all of our 52 agencies on aging in that line item, in their Penn Care funding, they use dollars and other dollars that they receive on the federal side to support transportation initiatives in their own community. So as we talk about this struggle from a higher level, down on the ground, it's happening too. And as the resources continue to shrink, those demands are still on the system.
Now, I think since we began our show, we've invoked Aging Our Way, the governor's plan, at least 3 times. So that's my trigger to ask you fellas more about what exactly is in that plan, what brought it about.
Well, it's the governor's executive order that helped us create Aging Our Way PA. But it is our Commonwealth's plan. It's all of our plan for the next 10 years, how we will help and make sure older adults get to age in Pennsylvania the way they choose, with the dignity that they deserve, and the services they should have. So it is innovative in that we bring all state agencies. Over 30 state agencies and commissions came together to help build this plan. We had stakeholders, especially AARP, who helped us framework the plan itself, and who helped us make sure that, one, we got the input needed from older Pennsylvanians everywhere. We had over 20,000 points of input into this plan, hearing from caregivers, hearing from care receivers, hearing from people that want a better system so that they can age in their communities. Housing, transportation, direct services, the conversation that we had here today, they were the primary concerns of older Pennsylvanians all over the state in every one of the 67 counties. There's over 160 tactics in Aging Our Way PA to address anything from transportation and housing to public accessibility in parks. DCNR, Secretary Dunn, tremendous partner. The work that they do in DCNR helps make age-friendly parks all across Pennsylvania. Older adults consume our state park system at a higher rate than most of us, which is great. Grandfathers and grandmothers taking their grandkids there in the summertime while their children work. People fishing every day. You see that happening at state parks. Secretary Siger and the work that he is doing to make Main Street better all across Pennsylvania. Every time you improve Main Street, you put better lighting and you put better sidewalks in, it's more accessible for older Pennsylvanians as well as other Pennsylvanians. So the work we're doing across the state and the cross collaboration really highlights the needs of older adults, and the plan brings out the best of it. This is funding, this is stuff that's already happening. We're just connecting the dots.
And I think that the plan itself, the way it was set up by the secretary and the executive order from the governor, was really, it wasn't about what is the state going to do for this population over the next 10 years. It's what are local communities, what are mayors going to do, what are individuals, what are nonprofits like AARP going to be doing, how are we going to be helping out with the education, with the training, with the getting the word out on all these programs, working with it. So even though it was Secretary Kavulich and his team, when I say his team, he also worked, as he just mentioned, with all the secretaries across government here, as well as legislators had input into this and being able to get their constituents, to get the word in for them as well. And I think the other great point about this is that it's not a once and done. The Secretary said over and over again, this is a living document. We will be looking at this over the next 10 years. It's not like it's set in stone. If things are going to change, we're going to add things. We might take things out, but we will refine it as we go along. So I think it's one of the best things that we've had in a long time when it comes to older Pennsylvanians and really the map to say where we're going to go in the future.
Jason, you said the Aging Our Way PA program endeavors to look out 10 years. Now, it's been in existence at least a year at this point, I figure. So what kind of a progress report, what's been accomplished in the last year or so?
And I'm sorry, I don't mean to correct you, but it's not a program. Okay, it is our plan. So there's a difference. PACE is a program, Protective Services is a program. This is our plan, and by our plan I mean all of us here at this table.
Yeah.
We are looking to this is our roadmap, our mission, and how we're going to make Pennsylvania better. And like I said, the 160 tactics and what we are going to do with our sister agencies and our stakeholders will transform the state. Mm-hmm. We're asking for an investment this year. Again, we were lucky last year to receive an investment, $2.95 million. To help build out a caregiver toolkit. We've talked about the importance of caregivers in the direct care workforce. This helps those that are the unpaid caregivers that are out there, the unsung heroes that work a part-time job on top of their full-time job, taking care of a loved one. The caregiver toolkit that we're building with our stakeholders, with the right kind of input, with the right kind of refinement, that will go live in this spring, early summer, I should say. It will be something that's practical. It will be accessible. It can be accessible if you have English as a second language. It can be accessible for anyone, and be able to put to work immediately, helping you take care of your loved one. And like you said earlier, a lot of times this happens in crisis. What we're looking to do this year with Aging Our Way PA is to build the system of navigators to improve the Aging and Disability Resource Center that we have in Pennsylvania that has not seen investment in a number of years. ADRC is what we can build off of, to build navigators. What older adults asked us for. They want navigators to help us navigate those hard health systems, to help us get to the services that they need, to just give them direction on what they should do. When you look at PA Medi and what we have to do just to get someone on Medicaid Part B or Medicare Part B, it's a challenge for a lot of older adults. And we want to make sure that it's easy for them. It's one number. It helps them get to where they have to be, and it makes sure that they get the services that they deserve. That's the investment we're asking for this year.
Yeah, and I think just going back to the caregiving, toolkit that the department is putting out, I just think that there's over 2 million caregivers in Pennsylvania. And there's really no one-stop shopping like this to be able to say, I'm a current caregiver and I need, I need some resources. Can you point me in the right direction? That's what this is going to do. If you're a new caregiver, it can do a self-assessment possibly. To be able to say, hey, I'm a new one. Here, you feed some information in, and you'd be able to say, well, here's a one-page document for you. These are the things that you maybe need to start off with. I mean, it's going to be a great tool to be able to use.
Can I add one more thing?
Please do.
I just want to add. One thing that makes Aging Our Way also different is how it's being steered. We have a steering committee, the Long-Term Care Council, that existed before we built this plan, but the department wanted to make sure, one, we were held accountable by stakeholders, okay, that we're really making sure that the plan happens. AARP has a seat on that council, and others, people from the community, people from the disabilities community, legal services, other cabinet members are part of this council. Members of the legislature, are part of this council appointed by the governor. And this council guides the work of Aging Our Way, helps keep the plan moving forward, helps us make the adjustments that Bill just said will happen. So we have a really different way of approaching this. It's a stakeholder-driven process with stakeholder input and guidance the whole way for the next 10 years to make aging better in Pennsylvania.
Now, Bill and Jason, both of you have mentioned several times a toolkit, so I'm going to turn that back to you, Bill. That sounds like a tangible thing. I can absolutely visualize it, so if I open that toolkit, just what's in it? Try to tell me in simple terms.
Well, it's still being built, and it's really under. Jason has a great team. Secretary Kavulich has a great team that's working on it right now. It will be. It's going to be online. It'll be something that's going to be accessible that way, and there will be different sections of it that will be able to help. And it's going to be very interactive. It's going to be again giving you the support that you need as a current caregiver or a new caregiver just coming, that you're under stress, you don't know what's happening. You know, your mother just fell, now you have to deal with her on a regular basis. What do I do? How do I navigate this? That's what this toolkit is going to be able to do.
Think of it this way. Here's just one quick practical thing that you can get. I'm taking care of my dad all of a sudden. People in my age group, that's a life change that sometimes happens on a long weekend. I'm taking care of my dad all of a sudden. What is the first thing we do? We go for a resource online. We go on our phone. We go looking. You can get to the caregiver toolkit. It can give you tips immediately, like, is your house safe? Do you know what to do to make sure your father doesn't fall? Practical things you can do to make sure, one, that nothing bad happens when he's making the transition into living with you. Two, what are your first steps? Who should you call first? What can you do? Do you have an emergency plan if he has to go to the hospital? What's his medication? Like, all of these things that you think about after the fact, but you don't think about in the moment. Helping, guiding someone who's just entering that point of crisis, like you described, get to where they need to be so they can do it safely without stress, but also letting them know there's a lot of people like you out there, and we are here to help you. There's peer support. There's agencies like AARP.
And some of your problems might not be that unique, which is good news when people can share that experience.
That's exactly right. Yeah. And I think, too, that to be able to have something like this is a one-stop shopping, because as of right now, yes, some of this information is out there. I'm not saying it's not, but you'll have to go to several places and hopefully find the right number that you need or the right resource that you need. What this toolkit does and what the department is doing is they're pulling it all in one place, and they're making it interactive, and they're making it easy for people to find. And one of the things that we're going to be doing after the fact is, once it's up and running, we are going to be educating people. We're going to make sure that people know that this is out there to all the 2 million caregivers and their families.
So older adults told us loud and clear, we want a reliable source of information. Okay, and it's really, it's not true anymore that older adults aren't tech savvy and that aren't connected with either phones or other tablets and other devices.
That's right.
So while there is a population of individuals that choose not to, there's so many that are. They wanted something that was reliable. They wanted something that is safe. And that is what we built. It's on, not everybody wants to go to a government platform, but there's still a lot of older adults that do. Our platform is safe, it's reliable. It gathers the information and the connectivity in a very practical way that is very user-friendly, that can get their needs met really quickly.
Now, there are plenty of seniors in Pennsylvania that are enjoying the benefits of the property tax rebate program. I wonder if there's anything in the new budget proposal that would affect that or even expand it.
Well, I don't know if there's anything in there, but the governor, with his leadership and with the legislature, the House and Senate have expanded it several times now, and I know that they're all very proud of that fact, because what it's doing is it's helping people stay in their homes longer. We all know that utility costs are going up. We know that property taxes in some areas are still going up. We know that people have to be able to afford their food or their drug use, with the prescription drug use, those types of things. And again, those are all things that are going to put pressure on someone to be able to do that. So you have to pay all those things, and then you also possibly are paying for a mortgage or for your rent for an apartment. This program, now that it's expanded, are helping more people across the Commonwealth.
Yes. This year it's now $46,520 is the new cap. That's $1,500 more than last year. So we're reaching more people every year. We don't have those numbers, how many we'll reach this year, but we know it's going to be more.
Now, I understand this program has had some different names over the years, and I think currently they're calling it the Whole Homes Repair Program, which is about making necessary repairs to your homes. That was proposed last year. It's proposed back in 2025. Have you been keeping track of that? And certainly that would be good news for seniors if they could get those repairs done.
Yeah, I can tell you from our standpoint, we're very happy to see that this is back in the proposed budget. This is something, again, that people are saying that the repairs to their homes, they've been in their homes, they've raised their families in their homes are aging, they need repairs. Or you need to modify homes. Maybe you can't go upstairs anymore, or you need a lift, or you have to put another bathroom in downstairs. There are things that need to be done when you're modifying, and I think it's about $50 million to create this program, which is going to go a long way to help individuals stay in their homes longer. And it was proposed in the last budget. It wasn't kept in. It's something that AARP is going to be looking at and making sure that we have conversations with our colleagues in the House and Senate here to let them know how important this program is to the individual and their families to be able to stay in their homes and communities as long as possible.
Now, from what you're saying, Bill, it sounds like this program could go well beyond the necessary report of just fixing the roof. You noted a bunch of other things that might not strike some people as necessary. For example, some kind of modification to the home or the bathroom, for that matter.
Yeah, there's constantly, and
if they're covered, then that's great news for the seniors, of course.
Is. Well, we had our housing round. So the administration is hosting a number of housing roundtables all across the state. Yesterday, ironically, was the housing roundtable that focused on aging here at the Capitol. So stakeholders gathered from all over the Commonwealth to really talk about the needs, and this program did come up. And this program, one thing that we really don't sell enough, that Bill and his team have been selling, is this program benefits older Pennsylvanians more than any group. Mm-hmm. It really does. This is another one of those aging our way wins, because it's happening in a different department, but it's benefiting older Pennsylvanians. And it helps with those critical modifications. It helps you get a ramp. It helps you get that front porch repaired. It does do the roof. It does do, and helps make some of the modifications. All of the housing stock, most of the housing stock we have in Pennsylvania, I should say, not all, was built before the Second World War. We have old housing stock. We have many old communities that really have some challenges. Expanding, doorways and things like that are structural issues in some of these places. So we look at technology. We look at different ways we can do it and make sure someone can stay in their home. This program helps us get that across the finish line, and combined with other programs like the programs we offer. We offer home modification programs. We offer ways we can help older adults through our caregiver program, through our options program. Combined with that, we can really make sure that we guarantee an older adult stays in their home with just a few simple changes and keep them out of a higher, more expensive level of care.
When the governor made his speech about the budget last week, he spent a considerable time talking about neurological disease research. And it occurred to me that the Alzheimer's disease office within your department is still a relatively new thing, and I wonder how it's doing.
It's brand new. Thanks to the work of Senator Rosemary Brown and as a bipartisan effort, we had Act 11 that created the Alzheimer's office in the Alzheimer's Dementia and Brain-Related Disorder office in the Department of Aging. Again, relying on a committee assembled by the governors to help guide that work, to make sure that stakeholders like the Alzheimer's Association, the Jewish Healthcare Foundation, AARP, and others have a voice, have an input. The legislature has an input on how we're doing that work. So we have a new director, Megan Abbott. She is new to the role, long-time experience in state government and nonprofit experience. So she brings a wealth of knowledge to our department. She's building out her team right now. We've worked with the Alzheimer's Association and advancing states to look at other states and how they've modeled their offices, making sure we pull that information in to build our job descriptions. We're in the process of hiring the staff now, but while we're doing that too, we have some really important projects going on. We're looking at doing community education all across the state, talking about doing education work with federally qualified health centers to make sure primary care physicians can do early detection work, looking at ways we can make age and dementia-friendly communities real across Pennsylvania. Some really powerful work is happening in a very short period of time. We're really proud of the work that my team is doing, but even more so, we're appreciative of the $1.9 million that we were appropriated to build a division and to get services and dollars into the hands of the community and stakeholder partners that are really going to transform this space. We know it's impacting rural PA in a much different way, a much harder way, And we want to make sure we're doing our due diligence to get to those communities and give them the support they need.
Here's an issue that's not necessarily budget related, but it's a topic that we should talk about, even though you can find it unpleasant, the whole idea of a financial exploitation of seniors, and I understand that it's more frequent. And I wonder what's happening. What have you heard from your members, Bill? I bet they're in touch about that.
Yeah, with AARP, one of the major things that we do, so we do advocacy, education, and outreach. And one of our major education pieces is on scams and frauds, and people being, taken advantage of. And what we're seeing more and more is that people are going and getting, financially, going into the banks and taking out money and sending it to these individuals, and losing their retirements, losing a portion of their retirement, and it's just sad to see. So what we've been doing at AARP is making sure that the education is there, that we let people know like what you should be doing across the board, and then what we've been doing is working with the administration, with the House and Senate here in Pennsylvania, to say it's important that we do have some training, for financial institutions to be able to spot these types of scams. I know they do that ad hoc right now. It's not really across the board. It's something that we would like to see more of, and a training that people go through, the front lines, the tellers, so that they can spot it themselves and make sure and give them the ability to be able to say, no, let's take some time before you take these dollars out to think about that or whatever, or maybe contact the family or different things. It's a fine line. I know it's individual rights. We understand that, but we also understand that people are thrown into poverty because they lose their life savings because of a whole host of reasons.
Jason, I wonder if financial exploitation could be protected by the Older Adult Protective Services Act.
That's a great question, because we are in the process of working with the Senate, working with our stakeholders, of getting the Older Adult Protective Services Act updated. It's been nearly 40 years. It needs an update. The language doesn't reflect financial exploitation.
No changes for 40 years?
No changes for nearly 40 years.
Yep.
So it needs to reflect the language necessary for financial exploitation. It needs to address it. It doesn't right now in its current state. And I'm very proud to say that the department, stakeholders, the legislature, we're working hard together in a very different way to get this over the finish line this session. So we're refining the language, we're adding what needs to be added, we're looking at some of the areas of constitutionality that have plagued the act for a long time. We're making those corrections. Hopefully this year we'll see success.
Now let's move on, Jason, to the fact that you're going to have a budget hearing. That means you appeared in front of these legislators and tell them about the appropriation that you expect or would want, and your hearing is going to come up in a couple weeks. And how does the appropriation look like from 20,000 feet, considerably higher than the altitude we've been flying at for the last hour or so? Is it an improvement overall now over last year?
It's close to the same as last year, but again, critical investment. Critical investment, and 80% of the investment we're asking for goes to the area agencies on aging.
Right, which we discussed,
yes.
Yep.
The next piece goes to Aging Our Way, which we also discussed, building out the navigators that the older adults had asked for. And the final piece goes a small investment, and I shouldn't say small, an investment in the Department of Aging. The Department of Aging hasn't grown. The Department of Aging is serving one of the fastest, if not the fastest growing population of older adults. We're monitoring a system that does all of the work that we described today. We haven't grown. We need some resources. Our systems, our IT systems need critical upgrades. We have to make an investment to make sure we're able to do the work, to do the reporting, to report back to the federal government, the data that's necessary to keep our federal funds coming in. So there's some, there's some.
Could you use more staffing? How about that to reflect this growing number of seniors?
We do. We need more we need staffing. We need infrastructure, and we need to be able to meet the demand of the population that we're serving, and that's what we're asking for. That's the investment in the critical infrastructure at the department that we need at this time.
And I think the other thing to keep in mind, well, two things to keep in mind. One is, if you look at this budget, which is roughly about $51 billion budget, this is a small piece. This is what we're asking for, to be able to keep people in their homes, keep people healthy, give people dignity. I think is a very small number if you look across the board. The other thing to keep in mind and to let people know is that, when you're talking about this type of funding, for the most part, there are some outliers, but for the most part, these are dollars that are coming from the lottery fund. These are not taxpayer dollars. These are lottery fund dollars. And I think that's an important distinction to make so that people realize that that's the reason why the lottery dollars come in for programs like this, for support of the Department of Aging, for support of the AAA, support of the programs, whether they be the property rent rebate program, the PACE and PACENet program that we talked about earlier. These are the important things that are keeping people, in my opinion, alive in the community as long as possible, and it's something that needs to be done. And again, it's lottery dollars, not taxpayer dollars.
Let's talk about reaction to the governor's budget proposal. You know how it is when he makes his proposal. There's always reaction from not just legislators, but other entities as well. And the one I have in mind is the PA Healthcare Association. They said that long-term care is still in crisis. What's in the governor's proposal that might appease this association, or at least bring us up to date on what's happening with long-term care?
Well, I don't want to speak on behalf of PHCA or any other organization. I'll speak on behalf of AARP, but I do believe that they should be happy with the dollars that are coming for the direct care workers. That is something that has been, an issue or a concern for the PHCA for quite a while, in the nursing homes and the institutions. I think that alone is dollars that will be able to prop them up, to support them, give them, again, the direct care worker dollars that they need, possibly raising some of the hourly wages, the trainings that they're looking for. As I mentioned earlier, those dollars, will be going across the board. It's not just for older Pennsylvanians; it's also for people with disabilities as well, that have direct care workers, and it's for both in community with health choices as well as within in facilities.
Now, again, the governor's budget proposal is subject to change here. So, as Secretary, Jason, how do you feel about what do you want to protect the most? What do you hope will come out of this budget when it's finally approved in July? At least that's when the deadline is. What do you really want them to hold on to and not change?
Well, selfishly, from the Department of Aging, we would like our investment. Our investment, we believe, is reasonable, is right, is really there to support older Pennsylvanians responsibly in the best way possible. So we would like to see our entire investment. But if I, had to prioritize, I think we would have to say we need the full ask for our agencies on aging. We do. It's a critical juncture in the road that we need to make sure that system doesn't falter. Okay, we need to see the changes in our systems. We need to be able to navigate those older adults to where they need to be. So we have to make sure that we keep investing in Aging Our Way PA. It's really the map that helps us get better. It's really the map that helps us answer and do the things that older adults wanted us to do and need us to do. So they're my one and two. And like any good leader, we'll make, if we had to make a sacrifice, it'll be on our end, and we'll figure out what we have to do to make things happen at the department.
Our guests have been the State Secretary of Aging, Jason Kavulich, and the State Director of AARP Pennsylvania, Bill Johnston-Walsh. Thanks to you both.
Thank you.
Thank you.
That's it for Focus on Aging Adults. I'm Larry Casper. Thanks for watching.
Focus on Aging Adults is sponsored in part by AARP.